Hi, you probably can tell that I've come a little bit closer to the camera, but that's just because I'm going to be showing you a few things, and it's really important that you can actually see what I'm showing you here. So we are now going to be looking at pressure sores. You may have not have heard of pressure sores before, which is absolutely fine. A pressure sore is something that can be caused by an area losing oxygen to the area. That's what it is. So an area will start to die when the area has not got enough blood to go into the area, and with our blood, oxygen is carried to it. So if an area is dying, it's because there's not enough blood, there's not enough oxygen going to the area, and there's pressure sores that happen because of that. So a pressure sore can be caused or can happen anywhere really. How well you can see this. So you're looking at a gentleman laying down, and all the red bits are where pressure sores can happen. So we are looking at the back of the head, the shoulders, the elbow, back of the spine, toes, ears, shoulder, hip, knees, you name it, most likely is going to be a pressure sore area. So we need to be aware of what we can do to prevent that. So we are told to think of the word skin. Okay, so S is for surface. Are your support surfaces, for example, your bed, cushion and chair, suitable to prevent pressure ulcers? A nurse or carer can explain the different types of equipment and ask any questions you may have. So when it says that, we are speaking about pressure mattresses, pressure cushions, which hopefully you will see when you do your work placement. Your skin inspection, which is the other S in skin. Check your skin for pressure damage at least once a day. Look for redness or skin that is darker than normal. Do any areas of your skin feel hot or painful? Also watch out for blisters, dry patches or cracks in the skin. So we have a test that we use to decide whether someone's skin needs to have a bit of attention to it, and that is your push test. So what we advise is, if you was to push your palm now, as you release, it would be white. Yes, as you push in, it would appear white, as you can see here. As I push, it bounces back and it goes into a white area. However, if I had a red mark here and I pushed it and it returned white, then I would have no problems or concern about this red area. However, if I push it and the redness is still there and there is no white pigments, that is when I'm a little bit concerned and where it's going to start to concern me into a pressure sore. And at that point, this is where we are as carers are involved. So you would be asked to apply some Cavalon cream, which is a barrier cream, just a small amount to the area and rub it in, yeah? And that would be at every visit that you care for that particular client. You would then record it onto the system, and you would also inform your workplace mentor, which again, you will be assigned to very, very shortly. So, and that would be a grade 1 pressure sore, which will look something like this, which is just a red mark. Okay, it can develop, which I will be showing you the pictures of that in one moment. So this again is your map, and with the other letter, which is K in skin, which is keep moving and changing positions reduces the risk of pressure ulcers. So we encourage you to encourage your clients to move around as much as possible. The I in skin is incontinence and moisture. Wet or damp skin increases the risk of pressure ulcers developing. So we encourage you to encourage your clients again to make sure that they are changing their incontinence pads. Even if they are not wet with urine, they might have moisture from sweat or anything like that. So making sure that you are changing it. And we also recommend that you do apply your barrier cream every visit that you go and see your client. The N in skin is nutrition and hydration. Eating well and drinking plenty of fluids reduces the risk of pressure ulcers. There are many types of food that can really help with pressure ulcers, especially foods that are high in protein. That really helps with skin repair. This is a grade 2 pressure sore. As you can see, it's definitely more sore. It's a grade 2, it's a blister. I'm pretty confident that everyone watching this video, excuse that loud noise, it was a train going by. Everyone watching this video has had a grade 2 pressure sore if you've had a blister, because that's exactly what it is. So your grade 2, it's an open wound, it's a blister. This we don't get involved in. This would be a district nurse caring for this. They would come and clean it and dress it. It can then develop to a grade 3, just showing you that there. So the skin is lost through the entire thickness of the skin, damage to underlying tissue, muscle and bone not damaged, and it looks like a cavity-like wound. If you can't see that very clearly, or you do want a clearer picture, then by all means Google grade 1, grade 2, grade 3, grade 4 pressure sores, and you'll get a very clear image of what they look like, okay? And I'm sure we can imagine if we had any of these sores anywhere, they would hurt greatly. So we do advise a grade 1, we are doing as much as we can. A little bit of a graphic image for you. This is a grade 4 pressure sore, so the skin is severely damaged. Muscle and bone may be damaged, and it can be life-threatening when it gets to this stage, because the blood can become affected and you're at risk of getting sepsis. So we really hope the amazing work that you carers will be doing at grade 1 will stop any of this happening, okay? So if you see a red mark, all you'll need to do is relieve the pressure from that area, apply some cream and inform a district nurse or another member of staff, and we can help you to do that, okay? Good. So that is your pressure sores. So just things to remember: if you see a red mark, just give it a little bit of pressure, see what colour it changes to. If it goes white, then you're okay. Just give it a little rub and a little cream, that's still fine. If it's red, that's when you'll need to report it and apply some cream also, and just keep on top of that with rubbing it and creaming it, okay? And that is the end of your pressure sore.